Thank you for joining us once again. Our weekly talk about wellness from Cormadam Wellness Center. Today, once again with me, Aldi Geldenhuis. Now, Aldi, last week we spoke about the older people. You call them the Goldies. But today I would like to touch on ozone, which is part of the therapies that we do at Cormadam. Now, ozone is not a new thing, though when we speak to people in general, they would say, so what's ozone? They believe that it is a layer of air around the earth and that you need to go up there to fetch it and bring it back. And that's the only way you can get to, it's not the situation. Or if you tell them that it is a super oxygen, they also have a bit of doubt. But you and I just discussed it. It's been in practice since 1857. And it's not a wonder cure, though it does amazing things. How did you get in touch with ozone?
So I got in touch with ozone therapy about 3 years ago. From a young child, I would constantly struggle with my lungs, asthma, sinus, and ever since I was small, ever since I can remember, I was a highly anxious child. And as you grow older and you suffer, you start looking for help and alternatives. And I remember as a young child, my mother was actually very open-minded. And she used to take me to a homeopath that is still practicing in this town, a wonderful gentleman. And he treated my asthma and my sinus in those years with homeopathic remedies. So luckily I was raised in a house where the holistic approach or the alternative approach was like breathing. It was normal things. So for me, from a young age, I would look for something alternative. Especially if I use something and it doesn't work, I would keep looking. I'm an inquisitive person. I am what we call a seeker.
Okay.
A seeker that does not like to suffer.
Brilliantly
And
put.
built for comfort, not for suffering.
Yeah.
So by the age of 38, I was at a very low emotional point in my life, going through a lot of trauma, and I was going through a lot of darkness. My son was I think five years old, and I was severely debilitated by constant lung infection, urinary tract infection, high levels of anxiety, and I would get these depressive episodes. And I remember I've always fought it. I luckily have the spirit of my ancestors that fights back. I would lie on the carpet, but then I'll get up again. But magically, I met people that told me about a doctor in Johannesburg. She was a Russian homeopath. They told me about her, and they said to me, you know, you are complaining now about this and this and this. Talk to my girlfriend, she goes for ozone drip therapy. Why don't you try it? And of course, I don't say no for most things. I believe that you should, they say it in Afrikaans, ondersoek alle dinge.
En behou die
I
goeie.
don't know how to say that in English. Research all things, but keep true to what is right for you. You can
Brilliant.
say it like that. But they actually bought me a drip for my 38th birthday from this doctor lady. And I went for the drip feeling, I've got nothing to lose. It was an ozone drip. I went to her and she explained it to me. She was a Russian lady, as I said. And she explained to me that ozone is a gas. So oxygen is O2. It's got two molecules that makes it, two hydrogen molecules that makes it oxygen. The minute you add another molecule, it's called ozone. And that third molecule that makes it ozone, the ozone is like an antiseptic or a sterilizing agent. Okay, so I'm going to try and explain it very easily so that we can understand. In your body, you have what is called free radical cells. Now, free radical cells are like little Pac-Man. You remember that
I
game?
remember that
Pac-Man?
TV game, yeah.
So if we do not lead a healthy lifestyle, we have cells that become angry. And these cells become like Pac-Man and they run around in your blood. And they are called free radicals. And free radicals are activated or made more aggressive through wrong eating habits, pollution, a lot of unhealthy things, smoking, excessive alcohol usage, drugs, and having a body that is highly acidic. So we want an alkaline body. In our body, we want an alkaline that's pH. And the more acidic your body is, the more your cells in your body, in your blood, become angry, free radicals, and they like Pac-Mans. Now what they do is they start running around in your body, creating havoc, and they eat and latch onto all your good cells in your organs. Now an ozone molecule goes and it kisses the Pac-Man. It hugs the Pac-Man. It bonds with the free radical. And it then causes that free radical to be let out of the body. To be, what is the word I'm looking for?
Dissolved.
To be dissolved and then to be released from the body. So it's such an amazing, amazing therapy. And ozone therapy is not dangerous. I mean, from 1857 up until 2022, we can go and look for the data. There's no deaths on ozone. Ozone cannot kill you, it cannot hurt you, it's not dangerous. We will not put it in a baby's vein, obviously. We won't give it to you when you are pregnant. But we have had clients here who come to the practice who struggled to breastfeed. And we gave them an ozone drip on a low concentration and their breast milk, it helps. So the ozone is such an amazing concept, but it's so easy. All it does is it's 3 oxygen molecules that is pumped in a gas, formed in a gas. You can smell it, it's got a very distinct smell, and that gas can now be used in various ways. You can use it in a drip, you can pump it in the air to sterilize the air. We pump it in the practice the whole day. That's why we have very clean air here. You can have those ozone capsules, you know those big ozone capsule machines
that you actually see like a sauna.
Like a sauna. You even buy those little ozone machines that you put in the bath and it makes bubbles in the bath. The best way that you can introduce ozone in your body is with a drip. Think about it. If I give you
straight in the vein
deep heat because you have got a painful muscle and we apply the deep heat ointment on your skin, yes, it's going to help. But if I give you an injection, it's going to take the pain away quicker because it's in your body. So it's the same with ozone therapy. I think anything is better than nothing. So if you can afford to buy the ozone for your bath, it's going to be a benefit. It's going to be a contribution. If you want to go and sit in the capsule, the skin is the largest organ in the body, the skin absorbs everything, you'll get the ozone in your body and in your blood. But the best way to do it is through a drip intravenously.
Now, we just said in the beginning of the program that it's not a wonder cure in the sense of you get your ozone drip now and you're cured of cancer within 20 minutes.
Yes.
It's not going to work that way. But what's the experience that you have? How long does it take before one sees an improvement?
Well, let me tell you, for me, it's a wonder cure in my life. I was sick for years. When I had that first drip, I could feel that night. There was like a fever in my body and I could feel that my body was fighting something. The doctor said to me, Aldi, you are very ill. You need to come a few times. I went full throttle, like you know me, all or nothing. So I had 3 drips in 3 weeks. I had 10 drips in total. And I must tell you, I had quite a detoxifying experience. I think that is what I went through with the 3-3-3 is what a druggie
goes
must
through.
go through in rehab, because my body really detoxified very intensely. Now, I was very ill, Marius, and I was fed up.
Being ill.
Yes. So I just said to myself, go big or go home. At Cormadam, I feel very, I'm sorry for the clients, and that I don't want that to sound pathetic, but I have a very soft approach. We are dealing, I always say to my staff, we are dealing here with people with hearts and emotions. So I like to introduce a drip a week for 6 weeks. See how you feel. If by the third one you should definitely start feeling better. If you are very, very sick, I will tell you, rather have 2 or 3, but then we will look after you and make sure that you don't struggle. I have not in the last 2.5 years had that intense ill patient where I've had to do 3 drips for. So we do 1 a week for 6 weeks, and thereafter you can decide. But I will tell you, I was extremely sick, and I had the 10 drips, and after the 10 drips I have had 1 drip a week. I still have 1 drip a week.
It becomes a way of life.
Well, I've
isn't it?
never been sick again for 3
Since
years.
then?
3 years. I've been through the COVID, through the coronavirus. I've never been sick. I have never been ill again.
How's your emotional side?
The emotional side comes from the bars. So it's interesting, I always call it divine timing. In the same time when I got involved or received my drip, I also met someone who did the bars, who did the access bar therapy. So literally within 3 weeks from the 2, I had started running my bars, and I had my bars ran, and then I had the drip. So the 2 complemented,
Together, yeah.
They complemented each other, and those 2 therapies changed my entire life. And that is why a year later, it took me a year to really work on my wellness, get well, get myself on track, find myself again, meet myself again, heal myself, get my body strong. And then a year into it, I opened Cormadam, because it changed my life so much. I just said, no, I have to. The ozone, the bars, it's all a gift. It's a gift that we should all give the world. It's a gift we should all give each other. Because if the worst thing that can happen to me is someone holds my head once a week and pricks my arm, and my whole life changes for
What
the
have you
better.
got to
What have I got to lose? So for me, I believe it's a wonder cure. I believe in the drips. I can tell you miraculous stories of what I've seen in this practice with the drips combined with the bars. Some clients just have drips, other clients just have bars. For me, the 2 together
Works well.
magic.
Now, getting back to Ozone itself, we do it in a drip form, but is there different strength?
Yes, and there's
dosages?
Yes, there is different machines also. So be very, very particular when you choose your ozone drip center where you go to. Make sure that your drip is administered by either a registered nurse, a doctor, or a paramedic. Make sure that that center, that IV bar or drip center you go to, has got all the paperwork, the insurance, and the medical protocols in place. Don't just go to a backyard mechanic. Be very, very picky and be responsible when you are looking after your body and your health. So we have a machine that we've imported from Russia with love. It's a Russian machine. It's the best. In Germany and in Russia, they have an ozone machine next to every bed in hospitals.
Serious?
Yes. So ozone therapy is big overseas. We can determine, we can set the setting on the machine with regard to the concentration level of the oxygen and the ozone therapy. So depending on how old you are, how frail you are, and what you need, we can put the settings on the machine. And then we pump it in the drip, and then we administer the drip.
So basically what we're saying, it is a custom-made drip just for you.
Yes. And it's safe. It's safe. It's effective. But it's a lifestyle. You will not come in here and okay, I must tell you. My staff will tell you, when I get a drip, within 10 minutes, I feel like I've had a refuel with Unleaded Plus. But okay, I've been a drip junkie for 3 years.
Energizer
I've
Bunny.
been a drip junkie for 3 years, but it takes time and it's an investment. Most clients will tell you, again, once you start, you don't really stop, but you listen to your body. And if you feel that trickle in your throat, or you feel, I am a bit under the weather, or my immune system isn't what it should be, then rather come and have a drip before it gets worse. So yes, I'm saying to you now on the program, I've never been sick, but the minute I feel, okay, my body is telling me, I'll go have a drip, then I'll have 3 a week. If I feel it's coming, then I know what to do. So it's a very good prophylactic. Prophylactic means prevention. So it's an excellent prophylactic therapy. And the benefits are immense. We will put the benefits on the page. But the benefits is immense.
So I would suggest that you do go and visit the page as well. Read through it after you've checked out our presentation. And thank you so much once again for joining us at Calmadam. And may you have a healthy week further. Thank you, Aldi.